There's dry run.
Are you cold?
Yeah, I am.
That's in August.
So I thought about whether it's
So
gonna
your
be
name
cold
was
in here or
on
not, but.
So July or something.
That's probably 15, that's the equivalent. Alright.
Already?
No, I remember those things. Like, there'd always be that year in the middle, every,
So is there
really,
something-
there'd always be that like infection that, there'd always be like,
So I feel
how
like
fast we go through that slide, so.
Yeah.
it'd be
I feel like
long.
everything's been crunched.
Stars.
I didn't even think about this meeting. It was like, oh, I have a meeting today.
So we'll find out people, I think.
Have you ever run into Lynn Smith up there in Lake County?
I'm not in Lake very much, but I know who Lynn Smith was.
He's on the board also. He's been on for a lot longer than me, longer than you're on there.
So it's all Vietnam on the board of, I think it's legit.
At least that's what they're planning, yeah.
Vietnam.
Yeah.
Holy cow.
Yeah.
Yeah.
Hard to say. Oh, Dr. Cameron, how are you?
How are you?
Hot day. Had better weather.
Yeah, because this one's gonna be different from the previous
I hope it
one,
won't be too
because
cold.
we just have a radiological release.
Okay.
So this, I mean, like you said, the dose assessment, basically doing that.
Adam reached out to you, obviously you're here. Okay.
So, that's it.
They assumed we had a thing.
His work's coming along pretty well, right? Frozen Lake.
Yeah, so walking around.
Few times.
There now, and, yeah.
Maybe we'll do it in 3 minutes.
So I can move it over a few times, so it was at home, I can tell you the stir crazy.
Oh, yeah.
Yeah, actually, yesterday, to Wilby Fire Department, Calgary, the portal monitors.
Oh, okay.
I have 26 more to go. That's something that FEMA will be checking, especially
Oh.
at the monitoring decon center. It's- That's for emergency work, that's
Oh.
right. They're gonna use, Wilby Middle School this year.
Okay.
And Lakeside, Mr.
Okay.
And it depends on which way it goes.
Yeah.
Which release there is. Yeah, yeah, I mean, that's why they picked 10 miles.
Yeah.
Because it didn't much, it's not good. Well, Fukushima, they said, talking about increase of
How are you? Good.
Oh, did they? Okay.
I can't see anything. I'm going to the sun
Like, I never
in here.
appreciated that.
Hey, Doc, how are you?
How are you?
Ben, hello.
for Geauga County, you're only talking about.
Oh.
Yeah.
Oh, yeah.
They chunk of money.
I have been proven
How are you?
this 4 times, and it's negative each time,
Here.
but I just
Oh,
not
yeah.
that I'm aware of.
I have the
Could
good.
have.
You a long haul or are you down?
You know,
I'm not sure.
I've never,
Totally safe.
yeah.
Actually, it's Troy
I
Township.
have so many questions. And you know what? That's fine. I have issues. But I really don't like that.
I just had this, right? It's cleared in this way. So it does get worse if I'm outside.
I have another jacket in the car like this one. You can wear this. I'm actually drying right now if you'd like it.
Have you staged it yet?
Okay. Yeah.
So,
I'm just gonna read this right here. Of course it's not.
No. Wild. Shady looking guy up front here. Not too much. How about yourself?
Just living a good life.
Living a good life.
Carolyn. Good evening.
Okay, everybody. Hello there.
Sabrina, how are you?
Apologize for not being on that list.
I got it. I'm like, okay.
Yes, I think they're paying for that every time, with the exception of that one meeting that was unusual. That's the time. That's set up. It's 5 o'clock, so we'll call to order. I'm gonna read the list.
Yeah. Did we look at the finance report? We didn't have any report.
I didn't see it.
Okay, that's what I thought. I just wanted to make sure I didn't miss something.
No, Henry started to send administrative personnel email in advance, they never read in the packet.
Yeah.
Finance is the only one that never went in the packet.
Okay, so there should have been one and we didn't get it?
I didn't see any emails. I didn't realize it was one.
Yeah. I didn't know people were just late getting them in, that's why we didn't get them.
That may be,
She's like, yeah, we told us this. I said, no, we did. It was out like a couple days ago. And that's when we found out. So we did change that though, so now we can deal with that. It's just another issue in the future. All right, Rich, you ready?
Yep.
All right.
Okay. Good evening, everybody. We're gonna call the meeting to order. So at this time, please stand for the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Okay, so did the board have a chance to review the, meeting minutes?
Yes. Is that how Joelle spells her name? Like Joel?
Yes.
Okay, I just wanted to make sure.
You threw me the first time as well.
Okay.
and, I did review them, but I'm not able to approve one of them, so you'll have to take individual votes.
So for the May 17th, minutes, I don't believe that's when the public comment section occurred. I believe that occurred prior to our vote. And there's also a typo. It says those who would like to comment T, and then those who would like to comment work.
And I
You
sent,
had completed in another one.
and I sent an email this morning to Alta on, there was a couple other typos on there.
Okay,
but-
okay. But I think that the public comment session, was held earlier in the meeting than what's reflected on the minutes.
Okay. We can, I'll look and, yeah, look at those and adjust it.
So my other comment is just on the minutes, we don't need to change these, but whenever there's an acronym, I'd like to see the words spelled out, what it stands for, and then the acronym, just so the public, when they review the minutes, is able to understand them better.
So can we approve the minutes as amended, or?
Yeah, we can make those changes on our side after.
Okay, so is everybody okay with that, approving the, minutes as amended? So
Which one?
We have to do them separately.
You have to do them separate.
Yeah.
Not everybody's here for each one of them.
we can do the 17th first, I guess, move to approve the minutes for the May 17, 2022 special meeting. So do we have a motion? Okay, very good. Do we have a second?
Second.
Okay. So, roll call vote.
Yeah, I remember.
So, roll call, Mrs. Brakey,
Yes.
Mrs. Roman.
Abstain. I wasn't here.
Okay. Oh, and there's three of us. Okay, and Mrs. Jones?
Yes.
And Mr. Moreno? Yes. Okay. So what about the May 24th minutes? Any changes to those?
I had nothing.
No, I have nothing on those. So
Okay.
I move to approve the May 24th, 2022 meeting minutes.
I'll second that.
Okay, motion is second. Okay, so Mrs. Brakey,
Yes.
Mrs. Roman,
Yes.
Mrs. Jones, abstain, and Mr. Moreno, yes. So that's approved. Okay, so the next thing is Environmental Health Division update. Mr. Lark,
Good afternoon, everybody.
good afternoon.
Just a couple of things. We have 2 new recent hires that are progressing pretty well. So we'll hopefully get them up and running on their own shortly. One pretty much is, and the other one is just starting really good training. He's been about a week or 2, so he's brand new to stuff. We're just about, we haven't spent it all, but we almost have all the money committed to spend the WPCLF money, which is the $150,000 in grant money. So we think we have all the systems lined up. We're just in the middle of getting the designs done. But we have 8 or 10 people already in line for that. So we should be able to use all that money very easily this year. If you remember, there was a action plan required from the state health department for the campground program. So there is an action plan that's been developed with most of the corrections have already been implemented, and we should have training tomorrow morning, I believe, where we should go over as part of one of our action steps to correct some of that stuff. So that should be on its way to being done. And we have started, the other issue is one of those, the House Bill 110 systems, the semi-public commercial septic systems, which we had to catch up on, and those have started this week. So we should be on track to be on track again with all that.
So, I actually met one of the new employees. I think his name is Dave. He came out to one of my listings over with Eric, and I was very impressed. He seems like he'll be a good fit, and seemed like he was pretty conscientious anyway.
Yeah, no, seems like a good guy.
And then the other question I have is regarding this House Bill 110. Now, it's my understanding that like some installers, if they're contracted with like say a restaurant or whatever to maintain that system, does any of that information, can that be used in place of the Department of Health going out there and doing an inspection? Like
No, it cannot.
Okay.
So,
I mean, like, they have to be there, they have to test it monthly.
Yes, they do.
I mean,
So,
it's a big expense.
Yeah, so they have to have a class 1 waste operator out there on a monthly, I believe monthly basis
Okay.
to do, check the system.
Okay,
And they should be keeping a logbook and documenting all the work they do on it and making sure it's operating properly. And then we go out and check the logbook and confirm that, what they've done and what they say they're doing and what they're observing is actually what's happening. And so we're actually like EPA's eyes and ears on that program to make sure the systems are operating properly.
so how many class 1
How many do we have?
do we have in the county?
Almost 500. So, and I'm gonna say that we're probably missing several hundred, to be honest with you. So, with the way that works out is if it discharges, treats the water, discharges, we have to inspect those on a yearly basis. If it's a soil absorption system, like leach trenches or something, we'd have to do those every 3 years. So we'd split those up into thirds and do a third every year for the 3 years. And so that comes out to about 220, 230 inspections a year.
Any other questions? Anyone?
And catching up on stuff, they set a record for a well inspection.
There's just a well permit we were dealing with today that was still open, but it was 12 years, taken out 12 years ago. Still.
12 days, 12 years. So Yeah, that may have set a record potentially in a bad way, but we are addressing those issues as they come up, and that was just one of the more interesting ones when you think of timeframes.
How did we find that? It was outstanding, like, just coincidental?
We can give the new environmental director credit for that, I think.
Well, no, there's some, I called to one of our clerical staff with some questions. And so when she pulled the file out, it was, she's like, I'm not sure what to do with this one right now. So then we, yeah, so we started just addressing and trying to follow up with the appropriate paperwork you need to see what the status really is on this.
In this campground action plan that we submitted to the state, are we gonna get any, like, I was asking Adam this morning, friend, so did we get are they accepting our plan, or?
So in my experience, typically the state just says, thank you for sending it. But they do, on our particular, that program, they will be out of 6 months to confirm that we have actually implemented what we said we're gonna implement. So, probably September, October, we'll probably get another visit from them.
Okay.
And I do have a copy for each of you as well, just,
I'm sorry?
I do have a copy for each one of you. It's
Okay.
just, it's a single page, but you all have a copy.
Okay.
Okay, thank you. So next is population health update, Mrs.
There isn't a lot to update in anticipation of the move. We're kind of busy, it's a slow month, but I do want to touch on, we attended a community outreach, the caveman crawl, which we saw Miss Breaky there. So what we did is we partnered, or it was put on by Geauga Park District, and what we did is we provided educational material on like ticks and mosquitoes. And then Sarah, our epidemiologist, ordered in from CDC these really, really, really nice, heavy-duty, weather-resistant tick signs that are actually for the trails that we gave to the park system to be able to distribute it along the trails. It is tick season. We've had 4 of them turned in from the public here. We've sent them all out to ODH. One did come back as identified as black-legged tick, and that's what carries, it's the vector for Lyme disease. It wasn't one that had bitten someone, but we obviously have them out there. We did order and received, this was interesting, we kind of tapped into Dan a little bit. They're familiar with it at Lake, a tick flag. And it's interesting that you do a drag. You go along the property line, you do a drag, and you see how many ticks come off. It's kind of felty on one side, and then you collect them and you send them off to ODH for identification. So we do have that. That's something that we could do. I don't know if we'll do it before the move, but it is something just out of curiosity to see what we have out there. So we have that. Sarah Sullivan and myself attended an outbreak training that was sponsored by Portage County Health and Summit County Health and sponsored by ODH, and it was on information pertaining to like foodborne illnesses as far as the investigative part of it, and collection in food, how do we collect food and prepare like specimens. So we attended that. I think I wasn't here for the last board meeting for that very reason. That was the event I was at. And then I have a couple of employee updates. Sherry Carroll, our registrar, resigned. Her last day is tomorrow. And then we also parted ways with one of our health educators, Brianna Berry, during her probationary period. We have, we're in the process right now of interviewing to replace both currently.
And why did Sherry leave?
Sherry accepted a position with Ashtabula County Health. It's 10 minutes from her house. It pays her more money, and it was just sort of a little, she gets a little bit bump and increase, but it's just closer to home. The new building was gonna add, it was gonna take her about 50 minutes one way, so unfortunately.
And we had discussed that as a team at the one board meeting, is that extra 15 minutes in when a lot of the staff doesn't necessarily live deeper into the county it is a problem. So
There's a few that we've anticipated that may leave. She was one of them, and so.
she's the second one that has cited that, at least recently. The other one was one of Alta's, Lisa Riley up front.
Chris
Chris Abraham as well, I apologize. He was on the sanitarian. And Zach Zach Myers was one that, it wasn't necessarily cited because we know the move date, but it was a concern of his, it added too much drive with gas being where it was. Obviously, it's only gone up, but it is an issue nonetheless.
In addition to these two, we have a public health nurse that's worked part-time for us a couple days a week, and she has also resigned. Her last day is next week. She has a conflicting position. She works somewhere else part-time that she's held that position for a long time, and it's now interfering with the schedule. So she's also resigned, so we're looking to replace her.
I just wanted to say, I thought you guys did a great job with that caveman crawl booth.
Oh, thank you.
They also did free blood pressure screenings, and whenever I walked by the booth, there was somebody talking to them and engaging them. So I thought that was a nice community event, a good place to be. There weren't that many tents there at the event, so it stood out as a spot people could go and check out what's going on.
It just took one person. One person started that, and then all of a sudden, well, I want mine checked. Well, I want mine checked. But it was funny, the first hour or hour and a half, no one. And then just one started, and it was just that ripple effect. Yeah, we had fun there.
And that is, thank you to Carol, and then obviously Magali Rios, who's our kind of communications person, but also health educator. We've been doing a whole lot more out in the public in the past, 5 months for sure, with just the different events, and one of the events being with Commissioner Dvorak, sorry, just talked to everyone, Dvorak, and dealing with them as well. So we're trying to be out there more and help out the more we can, be a better community asset to everybody. And then the tick sheet that Carol mentioned, that might be one of the videos that we do, is that tick poll to show people, how many ticks really can be in this very small area. That would be one of the videos that when we do this promotional type stuff, that would be one of those videos to show everybody just the possibility of what a small amount of grass can really have inside of it.
I hate to bring it up, but I'd just kind of like to get status of COVID in the county. I haven't seen
Today
or
we
heard
had
much.
6 cases. From the last board meeting, we had 34 reported cases. I do have hospitalization rates. I had Sarah put them together. It's nominal. It isn't anything that's one child hospitalized, 14 adults hospitalized. The average daily case rate is 11.6 cases a day. So we haven't had any reported deaths or anything.
Okay.
And that's statewide, right?
Well, this is,
that's
yeah,
county.
this is for our county. And Sarah pulls this from the Ohio Disease Reporting System, ODRS, is where she pulls the information.
And are we still doing some clinics where people can still get boosters?
We do clinics currently right now 4 days a week. To be honest with you, it is trickled way off. It is dropped to where we do maybe, some days we don't do any. And then as high as it can go maybe 6 or 7 in one day. But the demand isn't there. We are seeing a little bit of an uptick for the demand for the pediatric, which we just got standing orders today, which I will have Dr. Cameron sign tonight. And then we'll have to order the vaccine in, but we will have to talk about that as far as logistics with the move, the timing and the move. It may not be something that we can do until after the move.
And we're still offering this because we have access to the state nurses. They're provided by ODH. Those are gone relatively soon. And at that point,
Is there a timeline?
yeah, it's June 30th. is the-
Well, July 30th
Or sorry,
is
July
their
30th.
date. There was on our ODH call today, they talked about they may extend, but it will be a minimal extension. It won't be as extensive because of budget.
And so like Carol mentioned, we don't have 100 people a day flooding in. It's not the best use of taxpayer money. It's not the best use of our money.
Or the time, right?
The hospital that has PCP, or sorry, physicians have access to it. It doesn't make a lot of sense anymore.
We just have to scale back to a couple days a week.
COVID up. I had talked today about this, and that's if there's a significant change in the county, we'll make sure we give everyone an update, or if you want to ask, that's fine. But if it's something significant, we'll make sure it's
Just was curious, I thought we were probably.
we just talked today.
Ask a question?
Yeah.
Or maybe it's better than to consider cutting back.
Yeah, Carol and I have been talking about it. We're probably at that point. The state, though, they do have to work on only that. Something related. We can't use on anything else.
But when they're here, doesn't it tie up our staff as
It
well?
will tie up our staff because they have to have oversight questions. They have to have access to rooms that we have to give them. There is, and I had 2 it's an all or nothing, but we really need to look at that because then we're being wasteful.
Right.
When that can be shifted somewhere, that vaccine can be utilized somewhere else, a different county or statewide or whatever.
So just so, to help me understand, so the childhood vaccines, are those different than
Yes.
what the current?
Much lower dose,
Pardon me?
much lower dose.
Okay.
So right now, we're keeping several vaccines. So if we scale back, I think we just need to hone in on exactly what we're gonna do. And we were looking at that today, my nursing supervisor, we were trying to devise, going back and looking to see what are we immunizing the most of, what's the age group that we're immunizing the most of, to see if we have to scale back. We know that UH Rainbows announced that they're offering the children's vaccines, so if we can get a list of places that we could refer people to, that may be an option also for them.
Yeah, no, that's a great idea. So I would contact their public relations, we'll get you in touch with the appropriate people to say, for epidemiology and purposes of when are their clinics and stuff. So if you just go on the University Hospital's homepage,
Okay?
there's info, or if you just call Geauga and talk to their public relations, and I can give you their information, and they can get you in touch with the right people just to say, hey, here's how we can advocate for the appropriate clinics that are happening. But also knowing that there's other places too, maybe they can get you in touch, Cleveland Clinic Metro, other sites in the area. Now that Lake is part of UH, potentially offering it through those channels too. Have you guys thought, based on the information that you pulled demographic-wise, age, frequency of which people are coming in, times of day, have we thought about just setting a scheduled day or time that is more convenient for people? So, if people are having a hard time getting to places, maybe having scheduled clinics like from 6 to 8 p.m. every now and then, where you can just vaccinate a vial at a time.
And that's
So
what,
you're not
that's what we've
wasting-
been looking at, that's what Anna and I, we've been discussing on what's gonna work best. That's why we were pulling numbers, just to determine what's the largest demand. And right now, it's mostly boosters and it's seniors.
Yeah.
It's mostly what it is.
Usually they're 8 to 4:30, 8 to 5. We can make some changes, but they have to approve it, because they're contract nurse, they don't have to just say yes, they can't say no.
That's the thing about.
There is. I mean, our goal is to scale it back, it's just, we're working on a plan on how to do that, how to address people that need it. If there's low insurance or no insurance, who to issue them to? Do we have a day a week or a day a month where it's like a big clinic here at the new building, which we'll talk about later? Where do we do that there?
Can we partner with Department on Aging in the new building and potentially just have a second clinic if it is mostly seniors?
Probably. I mean, work with the senior centers amongst other things to pull them in a hopeful day, you know, so, yeah.
Okay, thank you. So the next thing is Administration Division, Ms. Wendell. Update.
So, it's good to see everybody. I haven't seen everybody in a couple months. We do have a new clerk starting tomorrow to replace Lisa. We're having a little juggling of job duties, so Joelle has taken on another program, and so we're going to have some moving around of those kind of tasks. I think I talked about this before, the software, the kiosk that we're going to have for people to check in with, that is on order. We should have that. I was hoping to have it before we moved, but now that we're moving in 2 weeks, we're probably not going to have it before we move. So we'll get that all set up. It was, I did the demo, watched the demo, they did it online. It is very easy, very straightforward. We can do it all ourselves. We don't need IT to program it or anything. We can do it all in-house.
And this will be when people come to the front desk, they'll sign in, they'll start at the kiosk?
I provided a copy of the supplemental appropriation that we're going to ask you to approve in new business. That's just to carry us through the rest of the year for those line items in that fund. As far as what's going on in the EH clerical area, since the police has been gone, I've been up there filling in, helping out with the phone calls and most of the plumbing stuff. We've had very good opportunities to cross-train. It's working out really well. Chrissy's touching on things that she's not had before. Joelle's touching on things that she hasn't had before. So it's really coming together, and they're making a good cohesive team. So I expect that when Holly gets there tomorrow, she'll just be able to jump right in. And everybody has kind of a good working knowledge, so if she has questions, she would be able to ask. That's about all I have.
Okay, well, thanks, it's good to see you too, by the way. Any questions?
Are we
Okay.
gonna go through the finances, or?
Yeah, I think Adam's gonna take care of
Okay.
that.
Yeah, I mean, these are just so middle of the year, they're just adjustments to carry us through, and it's just switching people around and doing the appropriations change, sorry, that second sheet is just modifications of those.
Anything you want to talk about, the finances?
Not necessarily, it's pretty cut and dry, most of it's middle of the year stuff.
I just had one question. Number one footnote on the Lake County, is that for, what period of time is that for?
It says January to April.
Oh, sorry.
I was gonna say, it should be January, there was some billing, the person who was supposed to bill wasn't billing, so we took care of that.
Sorry, I did read this,
Yeah,
but.
no, it's.
Okay.
I had a question about footnote 2, the SC Strategic Solutions.
Yeah.
So it says for scanning service. Can you elaborate on what that means?
Yeah, so SC View Strategic Solutions, they're a company that does a lot of schools, a lot of cities, things like that. You give them all your documents, they scan them, they put them in an online portal that we have access to, because it is HIPAA, I mean, there are HIPAA items, so it's not everybody's access to it. We do that here, where we'll give them boxes and they will scan it for us. They charge a super nominal fee for it. Lake County uses them as well as a bunch of some of the larger schools. It allows us to clear up space in the building so we don't have boxes and file drawers full of files. So it's just typical scanning, and especially as we get ready to move, and as we move, the hope is we can keep up with this. And all tonight actually just talked about, I've never used it because in Lake we never bought one, but they actually sell a scanner that supposedly you can it's a tablet, I'm guessing, of some sort. You select what file you want to go to. It scans it right to there. You don't have to scan it, then upload it, then check it. It's supposed to be a simpler process. Paul and I were talking about that. That way we could have someone, part-time clerk or one of our clerks has time, scan as we go instead of paying them to do it. Yeah, I'm not gonna say financially makes the best sense every time, but things are done faster versus waiting 4, 5, 6 months for them to do it. Because we just go into their queue. We don't give it to them 4 days later and scan. It might be 4 months, which isn't for everybody. It's not any different than anything else I've heard.
How much, and I don't know if there's really an answer for this right now, of everything that needs to be scanned, so that you could reduce the amount of paper that's gotta go, are we 25%, 50%, 90% the way there? In scanning documents? I know we took on scanning a while ago, but
Yeah.
are we pretty much making our way through that, or?
I'm trying to think. I mean, the active files don't get scanned because they're active. The other stuff that's in there.
The majority of the files that in EH that are existing homes that nothing's going on, we just have the majority of those are scanned.
Okay.
It's not to say that there isn't occasional one that they missed or got put in the file away and didn't get processed for the scanning. But the only thing we really have that's left open for the property files are the ones that are actually open, the active ones that have active permits.
What is the discard, once everything's scanned, what's the discard policy?
We actually have to.
Big bonfire out back or
So
what?
we actually have to change our record retention here at Geauga Public Health, because right now it's a big blanket thing that doesn't make any sense. I would love to say it should have already been done. It's more of with all the changes in staffing and trying to get the 5,000 permits or open inspections or open permits done. It's taken a little bit of a backseat. Not proud of that, but there were just more priority issues that dealt directly with the public that were an issue for us. Hopefully afterwards, we'll switch it to, if it's a digital copy, you don't keep the hard copy. Some might just be hard copy, but that'd be the goal. With the new system, that's mostly digitalized. so we don't have to deal so much with some of that stuff.
So we dumped a lot of paper out?
If we're allowed to, yeah, it's some of the stuff, there are things that are just lifetime keeps, where you just have to hold on to them forever. And there is archives in the county that have some stuff, there's some of the stuff we have, but my goal, all things willing, is to digitalize darn near everything, because it doesn't make a lot of sense. As an example, Lake County did our fire, we lost a lot of stuff, and there were things we didn't want to lose that we lost. And so digitalizing that, there's a tape backup to everything, you don't really lose anything. You just go grab it and re-upload.
Okay, I just want to make sure if we've got it digitalized and we can
Yeah.
get rid of it, we find a way to do that.
Yeah. Once we do our new retention schedule and legal blesses it, we'll be able to do a lot of changes.
Okay.
And Lynn, part of that with the SC view is all of the COVID, all of the forms, all the medical records that all got sent out. We sent out like 52 bankers boxes, pages full. So that all got scanned, and then they destroyed all those documents. That's all digital now. So
And that's what we want.
They're readily retrievable.
Yes.
Yeah.
In accordance.
I can pull it up at any time.
Okay.
Yeah, that's just where we need to be is,
Yeah. Well, and
we can't
there's,
keep moving boxes of paper around.
well, and there's concern on my end, the last thing you want is a bunch of HIPAA documents sitting in a file box somewhere. That
Somewhere.
there's so many of, nobody can track how many there are.
Right.
You don't, I want to have an audit record of, oh, someone accessed that, why?
Yeah.
What did you do with it?
Okay, I'm glad to hear we're,
And then when we move to the new building, being digital is going to be very important because the entire file system will be in the basement, 3 floors down, 4 floors down. So we won't, I mean, we're not going to try to hoof it up and down the stairs every day. We're going to rely strongly on what we have
it'll be your stairmaster.
digital.
Okay.
I have a question about that refund to someone for the FSLP. So is that someone that paid for the inspection and then we?
Yeah, I don't know that one specific, I don't know the specific one, but
Okay.
there were a number of call-ins relatively soon after.
Well, there's
saying,
just
"Wait."
one Mr. Galling that was listed as a refund, and I was just curious if that was somebody that paid and then we made the resolution and then they asked for a refund. Okay.
Yes.
Awesome.
And you'll
Great.
see next month, you're going to see a bunch of them.
Now, are we charging a handling fee of $30 or no?
Yes.
Because, so
why
once
does
we've
the
already.
big one say 475 or 480?
Well, that might have been a different one. That might have been one that there was a different circumstance, but the
Okay.
other ones are all for, they all get of the $30 processing fee.
Yeah, and as much as I would like to say we wouldn't charge that, once you've intaked it, and then you have to outtake it, and we have to get the county to approve it, there is significant cost in each one of those, just to process them and unprocess them and things of that nature, so.
So I have, and I feel like I ask this question every month.
That is the
But
last
we are
one.
supposed to be terminating our attorney, Clemens Nelson. Why do we keep paying them?
That was the last one I talked to Carolyn about that.
I
There
thought
was-
last month was the last.
There was a miscommunication on that, and I talked to her about it, and I said,
Not me, Carolyn.
Not you,
Yes,
Carolyn,
I did.
sorry.
No.
Carolyn from
Just to be
finance,
clear.
fiscal.
Yeah.
Her and I had a strong
I have it
discussion
off
about
there,
that,
guys.
and it was just,
So you're absolutely sure this time?
she sent an email and CC'd me on it that we are
Okay.
ending. Yeah. She did not send it the last time, it was a mistake on her end. Sorry, not on her end, it was just a follow-up error.
Okay. I mean, I know it's not a lot, but it's just irritating.
I was not looking forward to having you guys read that line. Believe me. It's my last thing I want you
You
to
should
read.
have, you should have redlined it.
Redacted.
Okay.
Okay, so anything else about finances? So do we have a motion to approve the finance report for June 2022 as presented?
So moved.
Okay, we have a motion. Do we have a second?
Second.
Okay. So, Mrs. Brakey,
Yes.
Mrs. Roman,
Yes.
Dr. Jones,
Yes.
and Mr. Bueno, yes, okay. So, now do we want to?
I'm gonna do my section real quick. I'm gonna blaze through mine now, we get the public comment.
Don't we want to do this?
Yeah, that's down here though.
Okay.
That's just for my update, I'll be at the superintendent's meeting tomorrow with them going over some of the school stuff, things how we can help. Hopefully no COVID discussions, but there'll be other nurturing things like that. New building, I sent an email out to everybody. Our move date is set for July 7th. That is the week of July 4th. We do have some staff that'll be out. Alta and Carol and myself have all canceled either vacations or requests off for a day or two that week. Mr. Lark is also making himself available. So pretty much everyone had to cancel something, but that was the date we were given.
Thank you guys for doing that.
Yes.
We appreciate that. Sorry to
100% them. In that,
What date is the actual truck show up, boxes go on?
July 7th. It's supposed to be a date. We do have a
The
call at 8.
boxes, the boxes are here.
I know, I can't believe
They got
they
you.
boxes versus crates, but okay.
Same discussion with the staff as to why we didn't have totes that were hard totes.
More expensive
I had
boxes.
some totes I had there.
Just need 400 of them.
Do you have like 500 of them or something?
Also myself, we do have a conversation with NV5 tomorrow. I have some concerns on some of the things they sent out, some things that weren't done, so we're gonna talk to them tomorrow. Yeah, great. So we're gonna have that discussion. Furniture-wise for the director team, we do not have our furniture yet. You're not gonna have it until after the move. So we are going to take like my conference table that you all see in my office. I'm gonna work off of that. We're gonna take a couple smaller tables and
Boxes, I'm
Yeah,
saying.
yeah, and there are 2 sit-to-stand desks that we'll probably take with us that match each other, and we'll use those as temporary desks for a couple other things, because we're not gonna have our stuff for about a week after we move. So at least I can sit down and do some stuff. The sanitarian layout is the only thing that is a little bit frustrating. We're gonna kind of split our sanitarian team up a little bit, which for team building is not the greatest, but for seating, we don't have enough seats for the sanitarians where it's laid out at. So we're gonna make that work. We did have a meeting with, Rich and I had a meeting with Kent State University today about internships, so we're moving forward with that.
Wait, can we stop on the
Yes,
move?
sorry.
Do we have the front office operations figured out? How late is the front office open on move day? And when does it reopen?
That's part of the discussion we're gonna have tomorrow. They have a
Oh.
3 to 5 day move grouping. Vital stats, in my opinion, which is birth and death certificates. Birth certificates people can probably wait on. Death certificates the funeral homes can't. That needs to be up and running the very next day. So they need to be the first moved out and the first moved in. So that might be some of our own personal stuff, like us helping out and moving stuff for them. We did the same thing when Lake moved, we moved buildings there. That was the one thing that if that was down, we never heard the end of it. So that's gotta be up
Yeah,
like
right.
lickety split. The other generic stuff, we're waiting to see how long, it says 3 to 5 days. Are they counting weekends or are they not counting weekends?
3
If
to 5
they're-
days for what?
For the move, for just us. We're listed as 3 to 5 days. So, I know that, I knew you were gonna eagerly await
They
that
should
number.
be able to show up with the moving truck, pick your boxes up, get them over to the new place, and you should be able to get your people in there to unpack.
We are listed as 3 to 5 days. So the question is, what does that 3 to 5 days entail? Is it because of moving other people? Is it because of what? And does it include weekends? Because if it includes weekends, either the director's team is gonna be there, or we're gonna have to mandate overtime, which goes over as about as great as it sounds, and typically they have to be there. Which, location being an issue, then mandating overtime, which could be they might have vacations planned, it's gonna go over about as great as that sounds. So we're gonna talk to them tomorrow, make sure it's not a weekend issue, and it's like maybe Thursday, Friday, Monday, Tuesday, Wednesday, and see how that lines up. The other question I have that we're gonna talk about is the next board meeting here, or is the next board meeting at that building? Because it's gonna confuse people if we're there for business, but we're not there for board meetings. And if we're here, is all this stuff gonna be here? Is it gonna be ready? Is it available? Is it gonna be set up? And if we are at the new building, is it the first floor or the third floor? I'm not keen on at 5 PM having people ride the elevators up and down, because we don't secure the floor. We just assume that everyone's left, which is a security issue for HIPAA documents. So that's a whole nother issue. So we are trying to communicate some of that tomorrow.
So what's wrong with the first floor? Why are you?
They are not moving in the first floor until later in the month. So there's no guarantee there's furniture there, there's no guarantee that there's gonna
What's
be
the
something
chances
set
of
up.
us canceling our meeting?
We would be able to prove the finances, which,
I think we have to have one.
Yeah, I don't think that's right.
I'm trying to think, it'd be hard to go without one because of the finances being approved. That'd be the hardest thing. Because if we can't
Well-
approve the check and we're behind by 60 days.
By July 27th, we should be up and operational.
It's not so much us operational, is the county offices that are used for meetings operational. That we don't know. So, and the county commissioners didn't meet yesterday. They do meet next week, which I'll ask Jerry then as well. But hopefully we'll know more tomorrow after our phone call.
Can we have our meeting in that township one?
We could schedule outside, yeah. We could schedule elsewhere.
Let's do this.
Yeah.
All right.
If you don't get the right answers tomorrow, let's just
Okay.
schedule.
We'll see first what we get our confirmation for, and then if that's an issue, we'll schedule it outside. Other location, not outside, other location. So, yeah. 5 o'clock somewhere, right? The other thing that came up at the county commissioners meeting is Jobs and Family Services got a 5% increase on top of their normal yearly increase. It's only a matter of time until that discussion happens here. Not saying we have to do anything, but to stay competitive, that's the biggest issue. We are, as you've seen, getting approached by their health departments, some of which were notoriously lower paying than we were, and they're now paying more than we are. That is an issue. Mostly for, I'm not going to throw everybody in the bus, but mostly sanitarians are what I worry about. If we're down sanitarians, everything in the county is pushed back, honestly. That's, 90% of our business. And we already are significantly behind on a lot of things that you're all well aware. So, just an FYI on that, and then that's it.
Okay. Any old business? So now we can go to new business?
Correct.
So, supplemental appropriation.
And this is just to carry us through the hopefully the end of the year. It's nothing crazy. It's just adjustments to salary lines as we move people around and hire people on.
So you want to read that? New business, Ashley?
Yep.
Move to approve.
Yep. So I'd like to move to approve the supplemental appropriation to Fund 6002-Board of Health as presented.
Roll call vote. So do we have a second?
Second.
Okay. Mrs. Brackey.
Yes.
Mrs. Roman.
Yes.
Dr. Jones.
Yes.
And Mr. Moreno, yes, that passes.
And if you're okay, we'll move to public comment.
Everybody else,
Thanks.
does anyone want to speak for public comment?
We do have Mr. Snyder, Mr. Siffin, Mr. Sepchek. Are you?
Kind of tutoring.
It says possible, so I'm gonna leave it as we're teetering.
I left that open-ended.
Also, just as an FYI, Mr. Brown, Dr. Brown, I should say, Doc Brown here, he's on the Lake County Board of Health. He's wanted to come down and see how things were going, and so he is here as well. Would you talk about Dr. You were the first on the list, actually. You get 2 minutes if you'd like to talk.
2 minutes, am I on the clock? I just wanted to come down. We're a couple of our team members are down here, and it's just inspiring to listen to them both. I mean, they're such a value to the health department in Lake County. And I just think there are probably things down the road that we could discuss, talk about, that would mutually help everybody. I think our board is open to that. I wanted to kind of break the ice there. I'm not down here to take over Geauga. That's not my point. I'm retired. I don't want hard things. I want easy things. I've been on the board since '99. My first meeting, Morris Beveridge was the president. The first meeting was the septic systems in clay soil was failing at a 70% rate, and in Concord they were going to stop construction. That was my first meeting. I said, holy crap. And Morris said, there are good people here, Doc, don't take it. And they are. It's a very good organization. There's a lot of good people. Adam and Dan, they're just examples of what we have there. And again, happy to be here, answer any questions you might have. If you want to come up and sit in one of our meetings, be happy to have you. I just think the dialogue should be open, and I'm breaking the ice to do it. It needs to be done, because we're working together.
Well, I
Thank you.
appreciate
Thank you for
that.
letting me show up.
And I appreciate so much that we're just fortunate that you guys are able to lend us some help. And I know you have some excellent employees, and I've been down to the Board of Health of Lake County, and I'm very impressed with your operation. And Of course, I really like the building too, that's pretty impressive as well. Plus the fact that you have other people that are, you know, in that building and are, you know, tenants, and I think that's a great opportunity. And hopefully maybe we can learn from that as well.
Yeah.
But,
You're building a new building or moving
Moving to a new building,
New
county
county
commissioner building.
in their building?
Yeah, yep. He just completed, not that long ago, they completed, finalized the building. We're on the 3rd floor, so we're moving in 2 weeks, give or take, and they're moving, I think it's almost a month is the full, I want to say the last people are like, end of the month is the 1st floor, something like that.
If there's anything we can do, and again, we'll be able to, like, feel like if there's something that you have to offer that we're not doing well at, I'd like to talk to you about it.
Sure.
I'd like to develop a dialogue.
sure.
We're going back and forth. That, I think, is important, because we're all in this together.
Right. It's all about, I think, collaboration, and, you know, you can do so much more than, you know, just one person or just one agency. If we can work together on different things, I think it's, you know, it's much more economical, and it can be, you know, completed in a lot more efficient manner as
Right.
well. So,
Okay, thank you for welcoming us.
thank you.
Thank you for coming.
Thanks for turning the air on also.
When are your meetings? I'd like to come.
Mondays at 3, the third Monday of each month.
Our next one's actually
And
this
it's
coming
actually
Monday.
this coming Monday.
Yeah, due to a scheduling issue. I usually still ask in case anyone wants to talk, but Ed, would you like to speak?
No.
No? All right. I still ask just in case you decide yes. Mr. Novak, there's a question.
Yes.
All right.
I write for the Weekly Villager out of Garrettsville, and I've been trying to put together an article just to inform people. There's been a lot of rumors that you guys are going to have yearly inspections of every septic system, all kinds of things. Where can I find out all the information necessary to tell people what's going on exactly?
Yeah, so I think, I know when you and I spoke on the phone the one day, it just hasn't been finalized yet.
Okay.
The operation and maintenance program will hopefully be going soon, moving forward soon.
Okay.
That's kind of why the for sale property somewhat was turned off relatively recently, was that so we can plan for the operation and maintenance.
Okay.
A couple of things, including staffing, came up that are pushing our deadlines back a little bit. But it's going to be a state mandated program. I shouldn't use the word mandated. You know, it's not mandated, but the state program. And so we're working on that. And hopefully once it goes to the board, that'll be approved. The goal is to protect the environment, but not to, you know, overdo it on any of the individuals in the community. I think the board stands behind that for most. I think that's been their statement too, is don't kill the community with fees, don't kill them with, you know, litigious things, just, you know, protect the environment and move on.
Okay, very good. So I'll just stay in touch with you every so often?
Yes, sir. If you want, you have my cell phone, feel free to check in with me and we'll help you out wherever we can.
Okay, great.
Thanks.
And just so you know, I mean, with the for sale of property, we've had that in existence for like 20 years.
Oh, yeah.
We have been behind with that program since the get-go. So imagine and that's only houses that sell in the county, right? So imagine trying to inspect every household in the county.
That kind of
Wherever
baffled
that
me
rumor's
whenever-
coming from is basically, that's an impossible feat.
Right.
And we do have, it's not, we don't know 100%, but we either have the most septics in the state, or the county, or the second most. I think Holmes County was the other one that was mentioned. But, so it's a monumental task that Mr. Larkin, actually one of the new hires that we brought in, Sanitarian, has done that before, rolling out that kind of a system.
Okay.
So now we have a little more expertise in how to roll it out, and a little more, I think they're prioritizing that customer experience as well, as to, you know, when you come in, you need help, is, you know, what kind of help are you getting, how are you getting it, how quickly are you getting it.
Right.
Yeah.
Okay. Another reason for me wanting to write this article, a lot of people that move from the city that have sewers
Yeah.
have no concept.
Correct.
That's so true.
They really don't, but it's flushable, right?
Yeah.
Okay.
Says it on the packaging, it must be true.
That's right.
Those wipes. That's what it is.
Right. So Is there going to be any kind of
Education.
informational thing, anything that?
Yeah, we actually just, we're entering into a contract with a company who actually works with the county and some other things for promotional videos, like 2-minute, 3-minute videos.
Okay.
And one of those is going to be septic care and maintenance, the operation maintenance program for sale of property. They're going to be pushed out over time, but we're actually looking forward to having some of those things, as well as ticks and other things, mosquitoes, that we can push out small 2-minute videos that'll hopefully get the point across, especially if you're moving from Geauga County or somewhere else, that'll, you know, hopefully put you in a better spot than the gentleman I spoke to last time. When's the last time your septic system pumped? I got, what?
Yeah, right.
Been there 30 years, it's never been pumped once. It's probably a thick layer of gel.
Oh.
So that does exist in the county, because he was open about it, that he had never heard about that. So that's where this program is more, as I mentioned on the phone, it's more proactive than reactive.
Right.
And so hopefully we'll be able to keep septics in the county versus like the Berkshire States type of issue, where when you have enough of them, the EPA comes in, they don't ask. It's,
Right.
you're going to do. So hopefully
Right.
we'll be able to protect that in the county.
Absolutely.
So,
Okay, great, thanks.
thank you, sir. Mr. Snyder?
Name's David Snyder. I want to bring it to your attention that last week I had one of your sanitarians come out and take pictures. Frank Claridge installed septic in my house back in March of last year. After many nasty emails from him, phone calls, finding him in public, I could not get him to come back and correct the work. He abandoned the tank, never filled in the hole. I had actually had somebody do it because of the risk of having it open. And I'd like to get a resolution. So going after his bond state to hopefully get some resolution. But I just kind of want to bring that to your attention because I've heard of other issues with his installs.
I won't say your whole address was 15330.
Yeah.
All right. Can I also, actually, if you can give Dan here your cell phone number or a phone number?
Okay.
We'll probably just maybe the last time we go out, if you don't mind.
Yes.
Schedule a day to come out and just take some
Absolutely.
pictures and look around.
Anytime.
Okay.
I appreciate it.
Yeah.
I'll catch up. Are you staying for a little bit?
Yeah.
Okay, I'll catch up with you.
Yeah,
Thank
we'll get your number. Thank you.
Yep.
Zach?
I'm just wondering the status of my situation.
Yeah, I think we're gonna have access to waive the fees that we're allowed to, specifically for what you're looking at. I think that's the generality of it right now. I think we have the authority to waive those for you. No one on the board has said no to me yet that I'm aware of that we can't waive fees. When I say waive fees, the specific examples of your system, which we have issues with, trying to be careful how I word this because they're approved by the state. There's issues with that specific type of system with the manufacturer. Mr. Lark also reached out to the state about if there's not 2 service providers, because there's supposed to be 2 service providers. Have we heard anything back about that? No. We've not heard anything back about that. That's a concern, I think, for the whole county, honestly, and there's more than just your system sorry. There's more than just your system, but that was a concern in general, is what happens if you guys don't have a service provider? You cannot find one, nor can the other gentleman. What do we do? So we are looking into that as well as what that option is for you. And then also, I'm trying to know the gentleman's name, the older gentleman, looking into his situation. I know he's lost hope, is honestly what it sounds like, but we're trying to figure out what we can do with him as well.
So as far as like the old system that I have goes, that's completely being replaced. So
Right.
anything with that is pretty much null and void.
Yeah.
State stuff goes with that.
Yeah, no, and I guess what I'm looking at is the new fees to put in your new system. If there are, so state fees we can't waive, but locality fees, sorry, we could.
I understand.
Theoretically, it would reduce your cost with your installer. So I don't think, the board, correct me if I'm wrong, I don't think we have any argument there with waiving that fee. The state was the one that we can't waive for any reason. We're just not allowed to. And we are looking at, yours and Adams were 2 that were more in the forefront, let me put it that way. We're still going to draft some language that will have guidance as to who they would apply to, so it's not just a blanket. It's just a blanket.
Where do you expect that?
I think
I'd like to move on this, like.
I think yours and Adams, I think we're fine if we can approve internally to waive those, and then we'll deal with the rest of them later as we draft some wordage with legal, so you're not being held up. When you're ready, I think Dan told the front desk to talk to him when yours came up, or Adams, and we'll address yours right off the bat. So when you're ready, just talk to, you have both ourselves, but talk to Dan and we'll get it handled on our side as fast as possible. Dan, do you want, I was trying to be very careful how I worded that statement, but do you want to say anything about that specific system or anything like that?
Not right now.
Okay. Nobody wants to get sued. But Zach, talk to Dan as soon as you're ready, and we'll handle that on our side while the fee split. So Rita, you're not going to. I always ask, but I know the answer is always we're here to observe, right? Legal women voters in the back, Rita. Mr. Sepchak?
Yes.
All right, go ahead.
First, I'd like to start off by thanking Mr. Lark, Dan, for being so responsive with all my phone calls and questions.
Oh, okay.
That's been unfortunately unheard of here in Geauga County, and you are the man for that. Thank you.
No problem.
My question is kind of, Dan and I have had this discussion previously. It's kind of in reference to House Bill 110, but it's the form that they give out. Do you remember the form? I don't have it, but where it has the verbiage down there about having to pull a permit even though a PTI has already been established by the EPA.
I know from I don't remember the form.
I don't exactly either, but just if you guys could take it under advisement.
So,
you could show that you're referring to.
Yeah, so you're talking about the inspection fee.
Correct, but the way it's worded in that piece of paper is that it's mandatory, you have to pull that and pay the fee prior to installing. And that kind of trumps the EPA's card, and when I called and talked to John Schmidt and Tony Nosko regarding this, they both said that, I think Tony said he had a discussion with you directly or indirectly regarding the same matter, that verbiage should be changed, that it shouldn't be an ultimate. It's kind of like an ultimatum, and at the same time it says you'll be fined if you don't pay the $350. The $350 is basically for the inspection. It's not for a permit over and above the EPA's, correct?
It's what I understand, the inspection fee, because the EPA. So he's talking about the semi-commercials, those 110 systems.
Yeah.
So when they're installed, they get a permit, a PTI permit to install from EPA. But the EPA, I guess, I don't know, strongly encourages local health departments to have a fee to come out and do inspections of those systems.
As you stated, the eyes and ears of the EPA.
Yeah.
If those particular counties are on board, Geauga happens to be one of them that is on board with that in reference to 110.
Yeah.
House Bill. But it's for an inspection fee only, it's not a permit. So in other words, the verbiage that's in there, and it's only a paragraph, maybe like 2 sentences in a paragraph.
Yeah.
And what it states is that you can be fined, that the installer can be fined by the county if they don't pay the $350 prior to installation.
Yeah, I'll have to look at that verbiage for like.
But you know what I'm talking about.
Yeah, we talked about that a
I
little
just
while
wanted to
ago.
bring it to the board's attention as well, and like I said, it's not something that needs to be done overnight,
Yeah.
just as long as it can be taken under advisement.
Yep.
And then one more thing, this is probably very redundant, I've never heard the answer to this from anybody. I've just heard people him-hawing around. I still don't have a clear explanation from anybody as to why Geauga County's installation permits are basically double that of just the Tri-County, for instance. Ashtabula, Lake, for instance, let me ask Adam. Adam, how much is an installation permit in Lake County?
It is less.
How much?
I don't know.
550, 600 bucks?
Yeah,
I think it's 5 something.
Okay.
it was
Ours is
5-ish.
1,174. You guys realize that, right? 1,174.
Yeah.
Cuyahoga is 550.
We did, so I want to say, is not to interrupt you, Mr. Lark and I have been talking about the redoing the fee assessment on all the, not, when I say redoing the fee assessment, looking at how the numbers were gotten, where they came from, and reassessing what those numbers should be, because that's one thing that, I've been here about 5 years doing the finance stuff on the back side of things. That's one thing that I've heard every year for the past 5 years, is how in the heck are all of our fees at more, by not just $10, every other county that's conjoining, for the most part. There's some odd ducks I'm sure that lay out there, but that's like Mr. Lark and I were talking about with campgrounds, with pools, spas, food establishments. That's a little different because it's a criteria by the state. But looking at all those and seeing where do they really have to be at, and what do they cover, and just reassessing those. And it should be done yearly, generally. There are some exceptions, but Mr. Lark and I are going to be sitting down towards the end of this year, like September-ish, and looking at all those fees and saying, what's enrolled in this number? How did we get to that number? Because like you mentioned, I mean, they are significantly higher. The problem I've had, which I do appreciate the comment, Mr. Lark, the wait times are longer too. So I've got a higher fee and a longer wait time. How
I don't
is,
even want to address that.
right, how do those match?
And me being a salesman, I would say, well, you're paying more for our excellent
You get what you
service.
pay for.
However, unfortunately, that wasn't the case prior to.
Mr. Morano, I would beg to differ with that one. At least previously, we'll see what happens in the ongoing future.
Yeah. No,
Okay.
we are gonna look at all those. I knew Lakes was 5 something, I just didn't want to say, I didn't want to throw out a random number, but it was 5 something, but we are looking at that because it's, so nursing, I'm just using as an example, we go to set a fee for like a shot or a immunization, you generally look at the surrounding area. So what are the private entities doing it for, what are the public entities doing it for? And you go, okay, if the general consensus is it's a $25 shot, we shouldn't be at 55. And so you look at that same thing and say, okay, survey the surroundings and see where we're at. And so we are
Like the
looking at
CMA,
that.
current market analysis. Mr. Morano would be very familiar with that as well. So,
Right.
again, I don't want to keep kicking a dead horse.
No,
I've never heard the explanation for it. I'm very curious to know what it is. I'm sure you guys can do what you're supposed to do as far as that goes, whether you can get it down, whether you can't. I'd like to see it on paper, where I could actually understand and say, okay, well, that makes sense. It just never has.
And that's the cost methodology that we'll do will be similar to that. As a random example, to Lake County Board of Health, we submit that to them. So we say, here's where we came out at, here's why it came to that, if you want to see it, here's the Excel spreadsheet. There'll be something similar to that, hopefully this year by September, November, something like in that area. What's that?
So we need to get there.
Yeah, I mean, the hope was earlier, but my hopes and dreams of a lot of things going earlier have been squished. But that'll go to the full Board of Health so they can see, A, maybe they're justified, and why. Why is ours higher than everybody else's? And if they're not, what does that dollar figure look like?
And again, I just want to reiterate to the Board of Health, it's double. It's not just 100, 200, 300. It's literally double. And versus Cuyahoga County is more than double. They're 550, we're 1174. Again, Mr. Lark, thank you for everything, the phone conversations that we've had. It's been pleasurable. Thanks. Good. No problem.
Thank you for that. Jonathan, anything?
I want to commend the administration and the board for their awareness and discernment and approach on the balance between fulfilling the duties of this agency and being aware of not overreaching. That's a tough balance to strike sometimes, so I just want to thank you for thinking through that as you iron out the maintenance inspections. And then secondly, I just want to say that I know the move is kind of scary, it's tough, there's unanswered questions, but once you get settled in Clarendon, you'll love Clarendon. If somebody is mean over there, they're probably not from Clarendon.
You got any trucks we can use?
Yeah, you can help us move.
We got a couple dump trucks, they're a little slow, but you don't got very far to go.
And then last, sorry.
We're good.
I figured we digressed there. Trevor, all right, no. That concludes the public comment session. I didn't think I missed anybody. I think everybody else did. Brian's not going to talk, so. I think that's a public comment.
All right, so, we'll go into executive session, you want to read that?
Move to adjourn for executive session to discuss pending litigation with counsel. This is a roll call vote.
Mrs. Brakey,
Yes.
Mrs. Rillman.
Yes.
Dr. Jones.
Yes.
And Mr. Perino, yes.
And we will be inviting in Brian Kostura, our legal counsel, and there'll be no action taken after that executive session.
When we come back.
Yeah.
So we're in executive session at what, 6:00?
Yeah. Down there.
6:05.
Thanks, give it a couple days.
Thanks, buddy.
Nice to meet you. Nice to meet you.
I always wanted to joke.
Nice to meet you.
I'll see if I can get rid of that.
Nice to meet you.
So it's go back to Pat.
I know, right?
Okay. I will make sure you sort of like take I didn't want to.
Okay, Rich.
See you later, buddy. I don't know if it's going to be 30 minutes or 2 hours. There's no action taken afterwards. back and say.
You want your stuff?
I'll give you both the options, but, yes, I'm hoping it's 30 minutes, but I'm not gonna. If anything changes, I'm sure I'll see Shelley or Caleb, I'll be like, hey, something, they're not, they don't have.
Good. Okay.
Are there any,
Everybody.
This time we did not. This time we did not. Usually just shoot that kind of forward. This time we didn't have. Yeah, sure.
Carol? Hi. I'm sorry, Lynn, excuse me. I just want to be Sorry, I appreciate that.